It's Dr. Ron, and I really want to talk about some updated data on broad spectrum hemp oil, endocannabinoids, terpenes, and bioavailability. Disclaimer: as I talk about a lot of clinical data, I will be talking about diagnosis and disease states. However, no information in this talk should be used to claim treatment, diagnosis, cure, prevention of any disease state. Furthermore, a lot of the data I speak about on animal studies and should not be interpreted to have the same outcomes in humans due to lack of human trials. So without further ado, I really want to get into the first topic is really I want to talk about the entourage effect. And what exactly is the entourage effect? So a lot of plants have different compounds of biochemicals within them that serve a particular purpose in the plants, but when ingested by humans, they have a very desirable effect in terms of wellness. And so the entourage effect is really the synergistic effect of different compounds and components that are in plants to assist in the pursuit of wellness in humans. And it's really something described as a multi-compound interaction. So this was first talked about in 1998 in regards to cannabinoid receptors by Professor Ben Shabat and Dr. McCollum. And so these professors looked at cannabinoid receptor activity and found that there's a synergistic effect amongst multiple cannabinoids on these particular receptors. And from there, it kind of grew into looking at entourage effect of not beyond just cannabinoids, but also terpenes, which I'll get into in a second. So the real question is, how big is your entourage, or what's in your entourage? So in some particular cases, you have cannabidiols, which is CBD, and that's the one that everyone knows about. Lesser known is CBG, cannabigerals, which I'll highlight in a second, which is very important, specifically looking at the new data coming out. There's CBDV, CBC. There's other ones as well that I did not list because the list will go on and on. And there's particular terpenes as well. And I'll get into what terpenes are in a bit. But, as part of the entourage, does THC have to be there? And we found out no, THC does not have to be there to be part of the entourage. And THC is the psychoactive component of the marijuana plant. But we find that even without THC, there's a lot of beneficial health effects. So let's focus on CBD for a second, and because cannabidiol or CBD is probably the most famous of them all, of all the cannabinoids, but it is one of many hundred cannabinoids that are found in the hemp plant. So cannabidiols have multiple therapeutic properties for brain function, for inflammation, brain protection, brain circulation. A lot of studies have been done on epilepsy, and there's actually pharmaceutical drugs made from CBD isolate to treat childhood seizures and caused by a rare genetic condition in the United States. There's the use of cannabidiols is also very popular in Europe, with some pharmaceutical medications in Europe with multiple sclerosis as well. And so, but CBD and its effects on the brain are very, very apparent. And in the case of traumatic brain injury, these cannabinoid receptors assist in neuroprotection after traumatic brain injury. And they actually help increase circulating of stem cells. It has a nice antidepressant effects and increase alertness and awakeness, and improves markers on brain mapping when we look at brain EEGs of people with traumatic brain injuries. So a lot of good effects there. And this is going into a lot of details, and this is for those healthcare practitioners who are watching. And if this goes beyond you a little bit, don't worry about it. This is designed for practitioners. This slide is. So I'm going to go into a little in depth of what cannabidiol's effects are on portions of brain health. When we look at memory loss or Alzheimer's disease, we really look at the hippocampal size. So if the hippocampus started degenerating at a more rapid pace, it's associated with aging and associated with some memory loss. What we found is that cannabidiols actually increase PPAR gamma, which is epigenetic signaling to stimulate hippocampal neurogenesis. So not just stop the breakdown of neural tissue in the hippocampus, but actual neurogenesis, meaning that these neurons are regenerating, if you will, and they activate particular serotonin receptors that increase this hippocampal neurogenesis and also battles depression. Now, this is a powerful statement because very few things can actually increase hippocampal size, but cannabidiols may be one of them. And BDNF is also increased, which is brain-derived neurotrophic factor, which increases neuroplasticity in the brain by allowing the brain to accommodate to particular toxins, inflammatory processes, and even ischemic processes. And we know that cannabidiols increase the proliferation of NPCs, which are basically neuroprogenitor cells and stem cells. And these are neural cells that differentiate into neural tissue to help with the regeneration. And neuroprotection and ischemia too by suppression of these particular inflammatory mediators like TNF alpha and of kappa B during ischemic injury. And so this is just a quick slide for the practitioners in the group who are a little more interested in the data behind the cannabidiols with references as well. So moving on to CBD and pain, cannabidiols actually improve a lot of different types of pain. So there's incisional pain after surgery. There's pain for inflammation and nerve pain, and there's also pain from drug withdrawal, and cannabidiols actually help with that as well. Improves pain from arthritis and even migraines. So moving into CBG, cannabigerol. So CBD is actually made from CBG. CBG is a precursor to CBD and THC, and as well as other cannabinoids. But let's look at this master precursor and what it really does. So it's a non-psychoactive component, so if you ingest it into your body, it does not turn into THC in the body. It only turns into THC in the plant, so it's non-psychoactive. And it occurs naturally in hemp plants in very trace amounts, generally because it's there to differentiate into other cannabinoids, and it's pretty rare and expensive to harvest and breed. And a lot of hemp these days are bred for higher CBG contents due to some of the studies I'm about to show you. It's got many potential medicinal benefits itself. So a little bit of history of CBG or cannabigerol. From 1990 to 2015, it's been shown to help in various different disease states. They're all in animal studies though, and possibly good for glaucoma, and possibly has an antibacterial property to it, antifungal property to it. It's been shown to improve an inflammatory bowel disease like Crohn's disease, ulcerative colitis. That was studied in 2013. 2014 is a possible agent to combat colorectal cancer by inhibiting some of the cancer proliferating cells in colon cancer. 2015, it's been shown to have, in mice model, some improvement in mice with Huntington's disease. And also in 2015, there's a study talking about helping possibly with bladder control as well. Now, that's a bit of a history behind it, but in 2018 is really the year that CBG came into light for a lot of different research studies. So let's talk about 2018, what we found in 2018 with cannabigerol, and in one study in 2019 as well. So as far as brains and nerves, cannabigerol has been shown to protect nerves in Lou Gehrig's disease, inflammatory states, as well as Parkinson's disease. So this is a very fascinating thing to look at. 2019, it shows that it assists in fat metabolism. Another study in 2018 showed that it helps prevention of complications of diabetes. And as far as the skin's concerned, there's another 2018 study that shows cannabigerol decreases allergic contact dermatitis. And also it's got a very interesting antioxidant properties to promote the anti-aging effect. So as far as the wellness compound, it's a very, very good one, just like how cannabidiols are. Cannabigerol or CBG is starting to be very well studied. So moving on to terpenes, what exactly are terpenes? So they're the aromatic compounds made by plants. So they have a smell and they have a taste to them. That's why they're called aromatic compounds. And they're found in many plants, not just hemp. And they give plants their unique smell and taste, and they have their own health benefits as well. So terpenes and terpenoids have their own mechanism of action that's really aside from what the cannabinoids can do, and they have a really good entourage effect together as well as with other cannabinoids. And they exist in less than 1% of the hemp plant from cannabis sativa, and they readily cross cell membranes, so it's easily delivered and help with nerves and muscles and neurotransmitters as well. So let's go through the list of terpenes that we have here. One is beta-caryophyllene. Beta-caryophyllene is very much talked about, exists in a lot of different hemp strains, and beta-caryophyllene itself is actually added to a lot of different hemp oils because it has a lot of different properties similar to what the cannabinoids do. It suppresses cancer cell growth, antidepressant effect, antibacterial effect, anti-anxiety, and pain as well. And it's got one study that's showing neuroprotective effects on multiple sclerosis. And terpinolene is another terpene, and it's got its own antifungal properties, antioxidants, and helps with cancer cells as well. Limonene tastes good because it tastes very citrusy, and that's part of the component of why people like to use it in particular compounds. But it helps breathing during asthma attacks, similar to what peppermint oil does actually. It's got its own anti-tumor activity, antifungal activity, and this one study actually helps with acid reflux and H. pylori suppression, which is H. pylori is a bacteria that causes acid reflux and stomach cancers, and stomach ulcers and duodenal ulcers as well. It helps protect against oxygen radicals, so that means it's an antioxidant, and it helps immune function as well and support against fungal infections. So limonene is a very important compound here. Linalool or linalool depends on which part of the country you're from or the world, pronouncing it. It helps improve with pain, helps suppress seizures, activity, anti-inflammatory, antipsychotic, anti-anxiety effects. And these are all animal studies that have been done in the past with that. In fact, a lot of these studies are done with multiple terpenes because these terpenes all exist together. Rarely are they by themselves. Myrcene, also another terpene. It's got its anti-inflammatory effects, anti-diabetic neuropathy effects, and helps with nerve pain. It's antipsychotic effects and help with sleep as well. Humulene, very similar to the last two compounds, basically, because humulene is generally studied with myrcene and linalool, or even limonene. And humulene has its own anti-pain effects, antibacterial, anti-inflammatory effects as well. And geraniol has very interesting mechanism of action because it helps significantly with neuropathic pain. Neuropathic pain is really difficult to control with medicines. It's pain that's stemming from the inflammation or aggravation of nerves. There's something called trigeminal neuralgia, which is a very painful condition with the nerve irritation in the face. There's peripheral neuropathy, generally affecting the limbs. And it also helps with spinal cord injury. It's got its own anti-tumor and anti-inflammatory effects as well. And so that concludes the terpene discussion, just on some just the terpenes. And I want you guys to understand that these terpenes definitely coexist together in nature, and they have very similar effects because generally they're studied together, and they have a very good entourage effect when combined with other terpenes and other cannabinoids as well. So this is the update of the endocannabinoids, terpenes, and what's been really going on in the last couple years. I just want to end by saying that there's a lot of hemp oil strains that's been hybridized to have a very broad spectrum profile, and that's the name of the game in 2019, is to be as broad spectrum as possible to encourage the entourage effect of these botanicals in hopes of improvement in our total body wellness. So Thank you, everyone, for listening. I appreciate everyone's attention.